Comprehensive NCLEX RN Challenge Exam 9. Question 1. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Pulling the auricle backward and upward, warming the solution to room temperature, placing the tip of the dropper on the edge of the ear canal, placing the client in a side-lying position. The nurse should avoid touching the ear canal with the dropper tip to prevent contamination of the medication bottle. Question 2. Nurse BEA should instruct the male client with an ileostomy to report which of the following symptoms? Absence of drainage from the ileostomy for 6 or more hours, passage of liquid stool in the stoma, occasional presence of undigested food, a temperature of 37.6 degrees Celsius. Absence of drainage for 6 or more hours in an ileostomy is a sign of a potential bowel obstruction and must be reported immediately. Question 3. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? Intestinal obstruction, peritonitis, bowel ischemia, deficient fluid volume. Fever, hypotension, and tachycardia in a patient with appendicitis are classic signs of peritonitis following a ruptured appendix. Question 4. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Myocardial infarction, cirrhosis, peptic ulcer, pneumonia. Acute pancreatitis can cause respiratory complications such as pleural effusion, atelectasis, and pneumonia due to inflammatory mediators. Question 5. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? Watery stool, yellow sclera, tarry stool, shortness of breath. The icteric phase is characterized by the onset of jaundice, which is most easily observed as yellowing of the sclera. Question 6. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of diuretics, antihypertensive, steroids, anticonvulsants. Dexamethasone, a steroid, is commonly used post-craniotomy to reduce inflammation and prevent cerebral edema. Question 7. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should increase the flow of normal saline, assess the pain further, notify the blood bank, obtain vital signs. After stopping a transfusion for a suspected reaction, the nurse must keep the 4-line open with normal saline to maintain access for emergency meds. Question 8. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? A history of high-risk sexual behaviors, positive ELISA and Western blot tests, identification of an associated opportunistic infection, evidence of extreme weight loss and high fever. A positive ELISA followed by a confirmatory Western blot test is the standard diagnostic protocol for HIV. Question 9. A client with chronic renal failure recognizes an adequate amount of high biological value protein when they select raw carrots, apple juice, whole wheat bread, cottage cheese. High biological value proteins contain all essential amino acids. Dairy products like cottage cheese are excellent sources for CRF patients. Question 10. Kenneth, who was diagnosed with uremic syndrome, has the potential to develop complications. Which among the following should the nurse anticipate? Flapping hand tremors, an elevated hematocrit level, hypotension, hypokalemia. Asterixis, flapping hand tremors, is a common neurological finding in patients with uremic syndrome or hepatic encephalopathy. Question 11. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse's most relevant assessment would be flank pain radiating in the groin, distension of the lower abdomen, perineal edema, Urethral discharge. BPH causes urinary retention, which leads to a distended bladder that can be palpated in the lower abdomen. Question 12. A client has undergone a penile implant. After 24 hours, the client's scrotum was edema-2 and painful. The nurse should assist the client with sitz bath, apply warm soaks in the scrotum, elevate the scrotum using a soft support, prepare for a possible incision and drainage. Elevation of the scrotum reduces edema and provides comfort following genital or pelvic surgery. Question 13. Nurse Hazel receives emergency results for a client with chest pain. An increased myoglobin level suggests liver disease, myocardial damage, hypertension, cancer. Myoglobin is one of the first markers to rise following myocardial damage, though it is not as specific as troponin. Question 14. Nurse Maureen would expect a client with mitral stenosis to demonstrate symptoms associated with congestion in the right atrium, superior vena cava, aorta, pulmonary system. Mitral stenosis causes blood to back up into the left atrium and subsequently into the pulmonary veins and lungs. Question 15. A client has been diagnosed with hypertension. The nurse's priority nursing diagnosis would be ineffective health maintenance, impaired skin integrity, deficient fluid volume, pain. Hypertension is often asymptomatic, and the biggest challenge is ensuring the patient maintains their treatment and lifestyle changes. Question 16. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin, including high blood pressure, stomach cramps, headache, shortness of breath. Nitroglycerin causes systemic vasodilation, which frequently results in a throbbing headache as a side effect. Question 17. Which of the following is a risk factor for the development of atherosclerosis and PVD? High levels of low-density lipid, LDL, cholesterol. High levels of high-density lipid, HDL, cholesterol. Low concentration triglycerides. Low levels of LDL cholesterol. Elevated LDL, the bad cholesterol, is a major contributor to the formation of plaque in the arteries. Question 18. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? Potential wound infection, potential ineffective coping, potential electrolyte imbalance, potential alteration in renal perfusion. Surgical repair of an aortic aneurysm involves cross-clamping the aorta, which carries a significant risk of impaired blood flow to the kidneys. Question 19. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Dairy products, vegetables, grains, broccoli. Vitamin B12 is found naturally in animal products, including meat, eggs, and dairy. It is absent in plant foods. Question 20. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following? Bowel function, peripheral sensation, bleeding tendencies, intake and output. Aplastic anemia involves pancytopenia, a low platelet count, thrombocytopenia, leads to significant bleeding tendencies. Question 21. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge's final assessment would be signed consent, vital signs, name band, empty bladder. A final set of vital signs provides the baseline for the surgical team and ensures the patient is stable enough to proceed. Question 22. What is the peak age range for acquiring acute lymphocytic leukemia? All. 4 to 12 years, 20 to 30 years, 40 to 50 years, 60 to 70 years. All is the most common childhood malignancy, with a peak incidence occurring between the ages of 4 and 12 years. Question 23. Marie with all suffers from nausea and headache. These clinical manifestations may indicate effects of radiation, chemotherapy side effects, meningeal irritation, gastric distension. In all, leukemic cells can cross the blood-brain barrier, leading to meningeal irritation and increased intracranial pressure. Question 24. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation, DIC? Administering heparin, administering Coumadin, treating the underlying cause, replacing depleted blood products. Coumadin is a long-term oral anticoagulant and is not used in the management of acute DIC. It would be inappropriate and potentially dangerous. Question 25. Which finding is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Urine output greater than 30 milliliters per hour, respiratory rate of 21 breaths/minute, diastolic blood pressure greater than 90 mmHg, systolic blood pressure greater than 110 mmHg. Urine output of 30 ml/hr or more is the gold standard indicator of adequate organ perfusion and successful fluid resuscitation. Question 26. Which of the following would the nurse include in a teaching plan as an early manifestation of laryngeal cancer? Stomatitis, airway obstruction, hoarseness, dysphagia. Persistent hoarseness is the most common early sign of laryngeal cancer due to the tumor's effect on the vocal cords. Question 27. Immunosuppressive therapy for myasthenia gravis is effective because it promotes the removal of antibodies, stimulates acetylcholine production, decreases production of autoantibodies, inhibits the breakdown of acetylcholine. MG is an autoimmune disease where antibodies attack acetylcholine receptors. Immunosuppression lowers the count of these autoantibodies. Question 28. A female client is receiving 4-mannitol. An assessment specific to safe administration of this drug is vital signs Q4H, weighing daily, urine output hourly, level of consciousness Q4H. Mannitol is an osmotic diuretic. Hourly urine output monitoring is required to ensure the kidneys can handle the fluid shift and prevent heart failure. Question 29. What is the primary advantage of using a pen-like insulin delivery device over traditional syringes? Accurate dose delivery, shorter injection time, lower cost, use of a smaller gauge needle. Insulin pens are designed for high precision in dosing, which is their primary clinical advantage over manually drawn syringes. Question 30. To assess for damage to major blood vessels from a fractured tibia, the nurse should monitor for swelling of the left thigh, increased skin temperature of the foot, prolonged reperfusion of the toes after blanching, increased blood pressure. Capillary refill, reperfusion, is a direct measure of peripheral arterial blood flow. A delay suggests vascular damage from the fracture.